waning thin today, especially when so much is needed to provide health care to the people of my state. Just this morning, a new poll came out from Auburn University that showed that a majority of the people of Alabama, including a majority of Republicans and a majority of Democrats, favor expanding Medicaid. Our hospitals and healthcare professionals have long advocated for this. All across Alabama. We did a program just recently. The Hospital Association has been begging for this for years to keep our hospitals open. They've advocated for it, understanding that without this, more and more of our hospitals will have to close their doors. They are working on either thin margins or they're underwater already, and the pandemic has made it worse. More than a dozen of our hospitals, rural and urban, have shuttered while Alabama has refused to expand Medicaid. Today, we have a chance to save the ones we still have, and perhaps even revive some outpatient services that have lost their provider. For every pregnant mother who has to drive hours for a round trip for prenatal appointments, or a rural Alabamian who lives 45 miles from the nearest emergency room, or the worker, those that are employed even that would benefit from this, who still do not have good health care and have to take their children to an emergency room for routine health care. It's for those people that I am committed to finding a way to expand Medicaid. So today I stand with my colleague, Senator Warner from Virginia, to once again call for the passage of our proposal to incentivize states to expand Medicaid. Our bill, the SAME Act, States Achieving Medicaid Expansion Act, would restore the financial incentives for states that expanded late and would give them the same fair shot at federal support as the early expanding states. The legislation would have the federal government cover 100% of the cost for the first 3 years, then would scale back to eventually cover 90% in perpetuity. Now, I want to make sure folks understand about this bill. This bill does not mandate an expansion of Medicaid. It still gives states the choice. So if the 13 or 14 states, including Alabama, choose not to expand Medicaid, even with this second bite of the apple, then they don't have to. Shame on them for not doing so, but they don't have to do it. And more importantly, if they were to do that, the thousands and thousands of people would get this health care coverage, including a very important point for the state of Alabama, and that is expanded mental health coverage. So many places that I've been to in the state of Alabama are begging for mental health coverage that they cannot afford in their communities. Expanding Medicaid would do just that. So let me be clear. Even without this bill, I still believe Alabama should take this step. We literally can't afford not to. We need to be investing in our citizens' health the same way we invest in trying to bring businesses into Alabama. We need to try to invest in our people's health because it will lift all boats. But if this incentive is what is needed to help us get over the finish line, then let's just do it. Again, it is not mandated. States don't have to do it. But for those states that do, they will see better health outcomes for their citizens and better economic advantages in areas that need it. Millions of Americans in these remaining states are struggling, and we can no longer allow politics to get in the way of their access to quality health care. So I urge my colleagues, please let my state have the chance. Let us have the opportunity to right the wrong that we did in 2011 by refusing to expand. Give me that opportunity to go back and try to convince the folks in Montgomery, Alabama, that this is the right thing to do. It's a common sense solution, and let's not stand in the way of more Americans getting health care amid a global health crisis. Thank you, Madam President. I yield the floor.
Madam President.
Senator from Virginia.
Madam President, thank you. I want to first of all thank my friend, the senator from Alabama, for his partnership on the SAME Act. And I'm going to repeat some of the same arguments he made because I think they're quite compelling. We are talking about health care, an issue that is weighing on too many American families at this point. And not just health care, but access to health care coverage. I think we would all agree, regardless of what we feel about this issue, we are in the midst of the greatest public health care crisis in generations. And in this unprecedented time, I think it calls for unprecedented action from Congress. So today, in a couple moments, I'm going to ask that this Senate take and pass unanimously legislation that I introduced along with Senator Jones from Alabama and several of my colleagues, legislation that could provide access to quality and affordable health care coverage for millions of Americans. To be clear, the same act is the bill that I've been pushing for more than 3 years. This bill was a good idea before the pandemic, but the need for it has become even greater in light of the COVID-19 outbreak. The same act would ensure that states like Virginia, and we did pass Medicaid expansion, but we passed it later than other states, that states that have expanded their Medicaid program to serve more Americans can get their fair share of federal matching dollars. It would also incentivize additional states, like my friend from Alabama, who haven't yet expanded Medicaid, to expand this critical program to millions of more Americans. I can think of no better time to pass this legislation than right now, when more than 5 million Americans find themselves having lost their health care coverage in the last 3 months alone. In fact, some reports actually estimate that nearly 27 million Americans have lost their employer-sponsored health insurance and are now in jeopardy of becoming uninsured. Our legislation would provide much-needed financial support to states that are seeing an increase in Medicaid enrollment as folks face the fallout of this crisis. And for those millions of people, the same act would provide a significant lifeline. Estimates show that if every state were to expand its Medicaid program, about 3 million additional Americans would have health care coverage. Now, I don't believe this is a political argument nor a philosophical exercise. This legislation has a real-world impact, and it's clear that Americans want and need this legislation to pass. As my colleague just mentioned, there are a number of states, red states and blue states, who've taken advantage of this opportunity. Just recently, Oklahoma. A few weeks ago, Oklahomans went to the polls and voted to expand their Medicaid program to provide broader access to coverage. We've seen similar actions from citizens in Utah, Maine, Idaho, and others. Across our nation, Americans are making clear they want expanded access to health care coverage, and I believe Congress needs to listen. Now, with all due respect to my Republican colleagues, you can't say you want to help Americans in this devastating time and simultaneously oppose this bill, which would actually provide that help. As we stand here in this chamber, we have the privilege of knowing that we and our families have access to health care coverage we need. That if something were to go wrong, we would be covered. So why shouldn't we ensure the same access for more Americans? The median cost of a hospitalization due to COVID-19 is $14,000. For Americans without health insurance, the nearly 30 million and growing, that could mean losing their house or their car. For many, it would put them into bankruptcy. Now, I know my colleagues on the other side of the aisle want to do right by their constituents and millions of other Americans that need help. So today, I'm going again to ask us to come together to support the same act. No one should go bankrupt because they got sick and sought medical care. But more importantly, no one should go bankrupt when this legislative body has the opportunity to act. So, Madam President, as if in legislative session, I ask unanimous consent that the Finance Committee be discharged from further consideration of S. 585, the States Achieve Medicaid Expansion Act. The bill be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table with no intervening action or debate.
Is there objection?